I'm a Russian facilitator of today's practice session with MiTio. Welcome. As usual, before the class begins, let me go over some reminders. Everyone must arrive on time, stay the full hour, and participate in order to receive credit. Please stay muted throughout the session. You will unmute your microphone once I call your name, and there is no need to enable your camera. This is an audio session only. If you would like to be an observer, you can do so. If you choose to be an observer, please let me know by using hand up emoji in the beginning of the session so I can see how many of you are actually participating to properly allocate time for every participating student. Any questions regarding the course you can ask during Dr. Lee's Q&A sessions, which take place twice a week on Tuesdays at 6 p.m. Eastern Time and Thursdays 11 a.m. Eastern Time. And I put the links for those Q&A sessions in the chat box for you. So now please have your dictionaries open and ready. Try to use standard medical interpreter protocol when you refer to yourself in the third person when asking for repetition, clarification, verification, or a moment to look up a term. Practice note-taking throughout the hour and write down any new medical terminology that you're not familiar with. Also reminding you to look up any word that you cannot find the equivalent and that you don't know the equivalent, to look it up in the dictionary. So if it comes up in the segment that you are interpreting, you already have it in front of you, so you don't lose time looking for it in the dictionary. We recommend that you practice by yourself daily. Don't just rely on these sessions only. WebMD and Medline Plus are great resources for your individual practice. Questions can be asked at the end of the session. I will leave 5 minutes for questions. We use our chat for peer assessment. This is where you can comment on each other's performance if you speak each other's target language. You can help each other with terminology and complement each other as well. The class is kept by 20 participants. Looks like we only have 14. That's good. What else? Yes, coaching sessions are also available, and the link is provided in the chat box for you. You can book a coaching session with a facilitator of your choice, whether you just want to enhance your practice or if you need to have an individual live practice session that will count as a live session for those of you who, for whatever reason, need to go through the course faster. Okay, this is about it. So let's begin. And yes, I will provide the proof of attendance, the code word, at the very end of our session. Okay, so Jake goes first. Do we have Jake? I did have Jake in the beginning when I was taking attendance. Jake, I can see your microphone on, now off. Do we have a connection problem?
Hello?
Oh, there you are. Okay.
Sorry.
So, no problem. Let me, I was typing the topic, but I didn't change my language. Okay, first topic is allergy. Let's go. Doctor, my daughter has me worried. She has not stopped coughing for 6 months. Okay, we lost Jake again.
Can you hear me?
Yes, I can hear you now. I guess I don't know. It goes on and off. Did you hear the first sentence?
Yeah.
Okay.
Yeah, I'll just try again.
Go ahead.
Doctor, estoy muy preocupada por mi hija. no ha parado de tener la tos para 2 meses.
How many months?
Por 2 meses.
Which is what?
2 months.
No,
2 months.
it's been 6.
Oh, 6
Mhm.
meses.
She coughs all the time.
Tiene la tos por todo el tiempo.
Yes, and also my eyes are itching.
Y también me pica los ojos.
Does she cough anything up, or does she have mucus in her nose?
Tiene moco, los mocos en la nariz o hay secreciones cuando tiene la tos.
Generally, the cough is dry, but she always has mucus in her nose.
En general, su tos está muy seca, pero interpret needs repetition of the last part.
But she always has mucus in her nose.
Pero siempre hay secreciones dentro de la nariz.
The mucus comes down inside the mouth to the throat, and then I feel like coughing.
Los mocos y secreciones se van por mi nariz hacia mi boca y me siento de tener la tos.
She's been coughing for only 6 months. Is there something in her daily routine that changed 6 months ago?
Solo ha tenido la tos por 6 meses. ¿Hubo un cambio en sus rutinas diarias que causó este tos?
Um, it's been 6 months that the cough is almost constant. Before that, she only coughed occasionally.
La tos ha sido constante por 6 meses, pero antes de esto tenía la tos. Interpreter needs to look up a word.
Sure.
A veces, no constante.
I don't believe that she has changed anything in her routine.
No creo que ella haya cambiado algo en sus rutinas.
Aunt Lala gave us a cat 6 months ago.
Interpreter needs repetition of the first part.
Aunt Lala gave us
Oh.
a cat 6 months ago.
Y tía Lala nos dio un gato hace 6 meses.
And you play a lot with it since it arrived, right?
Y juega mucho con este gato desde que este gato llegó.
Oh
¿Es
yes, doctor.
correcto?
She even
Sí, correcto.
she's even sleeping with the cat.
Sí, aún está durmiéndose con este gato.
Then this leads us to consider chronic respiratory allergic process.
Entonces, nos dirige a un diagnóstico de una alergia crónica.
Okay, very good. Thank you. Kate is next.
Yes.
Yes, hello. Let's finish up this topic and then we will switch. From now on, no sleeping with the cat, and she must wash her hands after touching the animal.
Empezando desde ahora, no puede dormir con el gato y siempre se tiene que lavar las manos después de tocar al gato.
Does she need any medicine, doctor?
¿Necesita alguna medicina, doctor?
Yes, of course. In addition to what we said, she can take an anti-allergy medicine daily if she needs.
Sí, por supuesto. Ella puede tomar una medicina de alergia cuando es necesario.
Okay, switching to seizures. Okay, seizures are sudden, uncontrolled changes in brain activity.
Interpreter needs repetition.
Seizures are sudden, uncontrolled changes in brain activity.
Convulsiones son actividades repentinas. Interpreter needs repetition of the last part.
Uncontrolled changes in brain activity.
Interpreter needs to look up a word.
Sure.
actividades cerebrales descontrolables.
They are a sign that there is a problem in the brain.
Eso usualmente son signos de que hay algún problema en el cerebro.
Most seizures cause a loss of awareness and shaking of the body.
Muchos de las convulsiones causa confusión y
Shaking of the body.
y movimientos del cuerpo.
Sometimes they cause staring spells.
A veces causan interpreter needs to look up a word.
Sure.
A veces causan hechizos de mirada.
Most seizures last less than 2 minutes.
Pero muchas de las convulsiones duran menos de 2 minutos.
And the person may be confused after the seizure.
Y la persona puede estar confusa después de que eso pasa.
A person who has repeated seizures may have a disease called epilepsy.
Una persona que tiene convulsiones bien seguidos tienen una enfermedad que se llama epilepsia.
It is not known why a person has seizures.
No es conocido por qué o cuándo una persona agarra convulsiones.
But the causes may include epilepsy, brain injury or tumors.
I'm sorry, interpreter needs repetition.
But the causes may include epilepsy, brain injury or tumors.
Pero las causas pueden incluir epilepsia, tumores cerebrales
And brain injury.
o interpreter needs to look up a word.
It's okay. You can write it down and look it up. We are moving on to the next student. Thank you. It was a good job, though.
Thank you.
Sure. Oksana is next.
Good evening, everybody.
Good evening. Let's continue with our seizures. Would you like to interpret from English to Russian or Russian to English?
Doesn't matter. Well, probably English to Russian would be
Okay. Yeah.
better.
Well, yeah.
Mhm.
In normal life, I think this topic would be done by the doctor, and you would be interpreting into Russian. That's right. Okay. So we're still going for causes of seizures. Alcohol or drug use?
Причиной могут являться алкоголь или наркотики.
Low sodium or blood sugar levels?
Низкий уровень сахара и в крови и натрия, содиум, натрия, да, натрия в крови.
Kidney or liver failure?
Отказывание почек или функции печени.
Alzheimer's disease?
Болезнь Алцгеймера. Алцгеймера.
Stroke? Lack of oxygen during birth?
Инсульт, недостаток кислорода.
During birth?
Во время родов.
Or a medical condition present at birth?
Состояние, определенное состояние при рождении.
And what's the English for, what's the Russian for or?
Или.
Okay.
Медицинское состояние.
Some people feel a warning sign before the seizure called an aura.
Иногда люди предчувствуют наступление, хочу сказать, эпилепсии, seizure, припадка, который называется аура.
This may be a headache, change in vision, hearing noises.
Это может быть головная боль, слуховые,
Changes in vision.
изменение зрения, слуховые галлюцинации.
Yeah. Or smell and a scent such as smoke.
Ощущение запаха дыма.
Oksana, for some reason you use
Smoke?
or. You use or in Russian as an or.
Okay.
Uh-huh.
Или ощущение запаха дыма.
During a seizure, there may be body motions that they cannot control.
Во время приступа могут быть конвульсивные движения тела, которые неконтролируемы.
Such as stiffening, jerking, or facial muscle movements. Stiffening.
Какие? Это застывать. Стифенинг, думаю, как лучше сказать. Состояние
like tension.
напряженности, состояние напряженности, что-то с лицом. Interpreter needs repetition.
Jerking or facial muscle movements.
Подергивание лиц, мышц лица. Что еще было?
And jerking.
Тоже подергивание. Подергивание,
somewhat.
сокращение.
Okay.
Сокращение мышц лица.
Thank you. Good. Okay. Victor.
Thank you.
Thank you. Victor. We keep losing people. Victor, I can see you on the list. No? Okay, I'll get back to you. The student, I don't want to mispronounce the name. So the last name is Wang.
I'm here. Xinru.
Yes, Xinru. Right. Okay. Switching to constipation.
Okay.
I'm bringing my son, Ricardo, because he has not had a bowel movement for 3 days.
我带我儿子 Ricardo 过来，因为他已经3天没有排便了。
Is he eating normally?
他是正常的饮食吗？
Not now. Initially, he was eating all his food, but yesterday his appetite began to diminish.
Interpreter needs repetition.
Not now. Initially, he was eating all his food, but yesterday his appetite began to diminish.
现在不是，他开始的时候还吃了所有的食物，但是昨天他就食欲下降。
Now he only wants to drink liquids, and when I touch his belly, he complains.
现在他只想喝液体，当我碰他的肚子的时候，他就感到疼。
I understand. Yes, he really looks a bit distended.
我明白了，那他看起来这肚子有点肿，有肿胀。
Has he had anything else, like vomiting or fever?
那他有其他的问题吗？比如说呕吐，或者是发烧。
This morning he burped and threw up part of the milk that he had drunk.
今天早晨呢，他打了饱嗝，然后把他喝的牛奶吐出来了。
I took his temperature, but he did not have fever.
我给他量了体温，但是他并没有发烧。
Some little children can have intestinal obstruction.
Intestinal
Intestinal, like intestines, the bowel, yeah.
有些小孩可能会有肠堵塞的情况。
which begins with those symptoms.
就是从这些症状开始的。
I'm going to request an abdominal X-ray to guide us in the diagnosis.
我会给他做一个 X 光，然后来做出我们的诊断。
Okay, doctor, do you have the results now?
好的，医生，那现在有结果了吗？
Yes, the radiograph shows that it is only a case of severe constipation.
好的，这个 X 光显示的，他只是有严重的便秘情况。
We're going to give him an enema.
我们会给他灌肠。
Afterwards, you will take him home and you're going to give him mild laxative for a few days.
然后你把他带回家，我们会给他一些温和的泻药，用几天。
That will help him regulate the bowel movements.
这个会有助于他正常的、有规律的排便。
We have a little bit time left. Switching to ulcerative colitis. I put it in the chat for you. Okay. So ulcerative colitis is a bowel disease.
Interpreter needs repetition.
Ulcerative colitis is a bowel disease.
胃溃疡，肠溃疡，是一种肠道的疾病。
The cause of the disease is not known.
这个原因呢还不明。
Okay, thank you. Good job.
Thank you.
Victor, are you back with us? Hello? Okay, I'll try again later. Evers?
Hello, Tatiana, can you hear me?
Yes, I can hear perfectly.
Perfect, thank you.
Let's continue with our ulcerative colitis. The inner lining of the colon, also called the large intestine, becomes irritated or inflamed.
El recubrimiento interno del colon, que también se le conoce como intestino mayor, se irrita o se inflama.
Tiny sores or ulcers form and can cause bleeding.
Interpret this repetition, please.
Yeah, it was my intonation. Tiny sores or ulcers form and can cause bleeding. Form is a
Se
verb
forman
here.
unas...
Go ahead.
Thank you. Se forman unas llagas pequeñas o unas úlceras y estas pueden causar sangrado.
This often starts in the lower part of the colon and can spread.
A menudo esto empieza en la parte inferior del colon y se puede expander.
You may have some or all of these signs.
Es posible que usted tenga todas o algunas de estos síntomas.
Stomach pain, diarrhea,
Dolor estomacal, diarrea,
bleeding in stool or from the rectum,
sangrado en las heces fecales o proveniente del recto,
fatigue, loss of appetite,
fatiga, falta de apetito,
weight loss, loss of body fluids, also called dehydration.
pérdida de peso o pérdida de los fluidos corporales, que también se le llama deshidratación.
Signs may be mild or more severe.
Estos síntomas pueden ser leves o más graves.
Your doctor will check you and order some tests.
Su doctor va a revisarlo y le ordenará algunas pruebas.
These tests may include a stool sample to test for blood,
Estas pruebas pueden incluir lo que es una muestra de heces fecales para poder detectar la presencia de sangre,
a barium enema to see an X-ray picture of the colon.
un enema várico o una radiografía para poder ver el colon.
A test to look at the inside of the rectum and colon called well, why do you not colostomy? They put colostomy. That's wrong. Colonoscopy. Colostomy is when they create stoma. So let me repeat the sentence. A test to look at the inside of the rectum and colon called colonoscopy.
Una prueba que permite ver el interior del recto o del colon, y esto se le llama colonoscopía.
Sometimes a tissue sample called a biopsy is taken to be checked in the lab.
En algunas ocasiones se toma una muestra de tejido, y esto se le llama biopsia, que se lleva y se revisa en el laboratorio.
Your treatment may include diet changes to help control signs.
Su tratamiento pudiera incluir cambios en la dieta para poder ayudar a controlar los síntomas.
Avoid foods that make your signs worse.
Tiene que evitar alimentos que hacen que sus síntomas empeoren.
These may include fatty or fried foods and high fiber foods such as beans, nuts, seeds, or bran.
Esto puede incluir alimentos que sean grasosos o altos en colesterol, y también puede aumentar el consumo de alimentos ricos en fibra, como los frijoles, las nueces, las semillas o el trigo.
Very good. Thank you.
Thank you very much, Tatiana.
Thank you. Victor, hello. No? Okay, I will make another attempt later. Florence?
Hello.
Hello. Okay, we are switching to hernia. Doctor, I have something here in the right groin.
Muganga mfite ikintu hano mu rubavu iruhande rw'ibumoso.
It pops out each time that I make a force and lift weight.
Buri gihe kirazamuka kikamanuka igihe mfashe ibintu biremereye.
And it always disappears on its own.
Kandi kikongera kikaburiramo simbibone.
But now it's been 4 hours that it doesn't want to go back in.
Ubu ngubu hashize amasaha ane kidasubirayo.
Yes, this is an inguinal hernia.
Iki kintu bacyita imenia.
The area is hot, very red, and has inflammation around.
Kiba ari umutuku kandi kikagira ububabare cyangwa ibibyimba ku ruhande.
Have you had fever or vomiting?
Hari ubwo wigeze ugira umuriro cyangwa gucibwamo?
The only thing that really is bothering me is the pain.
Mu by'ukuri ikintu kimbabaza cyane ni ububabare budashira.
The temperature 1 hour ago was 101 degrees.
Ubushyuhe bwari buzamutse bugera ku ijana.
I began to have nausea 30 minutes ago, but I have not vomited.
Hanyuma natangiye kugira isesemi iminota 30 ishize ariko sinaruka.
Part of the intestine remained trapped in this area.
Kandi ububabare bukaguma ari ahantu hamwe muri aka gace.
And after so many hours without blood circulation, the intestine began to be infected.
Hanyuma mu gihe gitoya amaraso atagenda numva hatangiye kuza ubundi bubabare budasanzwe.
So now what can we do?
Hanyuma ni iki nakora?
This is a surgical emergency. It's a strangulated hernia.
Ibi ni ibintu byihutirwa bifite kujyanwa gukorerwa kubagwa kuko babyita imenia.
The surgery team will have to operate on you. I'm going to call them right now.
Abantu bashinzwe kubaga bafite kujyana mu cyumba cy'ibagiro aka kanya reka mbahamagare.
Okay, we still have some time left. Let's go back to that ulcerative colitis that Everett was interpreting. So the treatment. Eat small amounts of food every few hours. rather than 2 or 3 large meals each day.
ugerageze kujya urya ibiryo biringaniye inshuro 3 ku munsi, saa sita na nimugoroba na mu gitondo.
Drink water all through the day.
Ujye unywa amazi umunsi wose.
Managing stress, which can make signs worse.
Ujye ugerageza kudatekereza cyane kuko iyo ibitekerezo byongereye ububabare buraza.
Medicines to control inflammation.
Imiti izajya igufasha kugenzura ububabare.
Or in some cases, it may require surgical intervention.
Cyangwa se igihe nikigera bizaba ngombwa yuko tukubaga.
Okay, very good. Thank you.
Thanks.
Rosanna?
Yes, ma'am.
We are switching to mammogram.
Uh-oh.
Mm.
Okay.
What is it?
Ready or not?
Sorry?
I'm ready.
Ready? Okay. Yeah. I know some topics can throw you off, but
Yes, ma'am.
we'll have to keep it calm and steady. Okay, let's go. A mammogram is an X-ray of your breast.
Una mamografía es un radio X de su pecho.
It is the best way to detect breast cancer.
Es la mejor manera de detectar el cáncer de pecho.
You should have a yearly mammogram after age of 40 or sooner if you have high risk of breast cancer.
Debes de tener una mamograma, disculpe, I'm sorry, I meant to say in English, después de la edad de 40, porque es la mejor manera de detectar el cáncer de mama.
Talk to your doctor about your risk factors.
Hable con su doctor acerca de los factores de riesgo.
Tell the staff before the test if there is a chance that you might be pregnant.
Y por favor, dile al personal antes de la prueba si hay una chance. Wow, why can't I say chance? Si hay una posibilidad de que usted esté embarazada.
Do not use deodorant, lotion, or powder under your arms or on your breasts the day of the test.
No use cremas, desodorantes o polvos en sus brazos o en sus pechos el día de las pruebas.
During the test, you will need to undress from the waist up.
Durante la prueba tendrás que desvestirte de la cintura para arriba.
You will be given a paper gown to wear.
Y te daremos un vestido de papel que ponerte.
You are asked to stand next to the machine.
Le vamos a pedir que se pare al lado de la máquina.
There will be at least 2 X-rays taken of each breast.
Vamos a tomar por lo menos 2 radiografías de cada pecho.
The person doing the test needs to touch and move your breast to get it in the right spot for each X-ray.
La persona haciendo la prueba tendrá que tocar y mover su pecho durante cada radiografía.
Small sticky dots may be put on your nipples to help show them on your X-rays.
I'm sorry, I'm going. The interpreter needs to look up one little word.
Sure, no problem.
Okay, I'm sorry about that. Yes, ma'am. Pequeños adhesivos negros se pondrán en sus pechos para la radiografía.
Can you repeat that same sentence in English to me?
Yes. Oh, I hope I said it right. I said that small sticky dots had to be put on your breast for the
Yes.
X-ray.
That's right. I just yeah. I just thought I heard a word that I thought, is it? Okay. No, never mind.
Adhesivo is
No. I know what adhesivo is.
Okay.
Yeah, we're good.
Okay.
My bad. But still, a good thing to double check,
Yes, ma'am.
Mhm. Also, this is where I would like to kind of quickly infuse. Be careful because sometimes providers won't show it, but they are speaking the language, the target language of the patient. They may not show it, but if they see that you say, for example, make a mistake and you do not correct yourself or clarify, they may not say it there, but they will leave the comments. So never assume that you're the only one in the room who can speak the target language.
Yes, ma'am.
You're told to take a deep breath and hold it while the x-rays is taken.
Okay. Te vamos a decir que respires profundo y que lo guardes para que podamos tomar la radiografía.
Okay, very good. Thank you.
Yes, ma'am. Thank you.
Yulisa?
I'm here.
Let's finish our mammogram and then we'll move on.
Can you hear me?
Yes, I can hear you perfectly. Is my sound okay for you? Hello? Now I can't hear you. I heard you.
Yes.
Yeah, okay, there you are. Okay, so let's finish the mammogram. There's just a little bit left and then we'll switch. Each X-ray takes less than 30 seconds.
La radiografía tarda menos de 10 segundos.
Each X-ray.
O
Right.
cada radiografía tarda menos de 10 segundos.
The X-ray may need to be repeated if the X-ray is not clear.
La radiografía tal vez tiene que ser repetida si la radiografía no es claramente.
If you have breast implants, more X-rays will need to be taken and the test will take more time.
Interpreter needs repetition, please.
If you have breast implants, more X-rays will need to be taken and the test will take more time.
Si tienes implantes mamarios, los exámenes van a ser más largos.
And more X-rays will need to be taken.
Y más radiografías tenemos que hacer.
When all the X-rays are done, be sure to remove the sticky dots and throw them away.
Recuerda que cuando terminamos con el radio X, los interpreter needs to look up a word.
Sure.
Los puntos negros pegajosos tienen que quitárselos. Interpreter needs repetition at the end. I'm sorry.
Then throw them away.
Y cuando se los quite, de tirarlos en la basura.
You will be able to get dressed and you can return to your usual activity.
Y después se puede poner su ropa y puedes regresar a las actividades normales.
Test results are sent to your doctor and your doctor will share the results with you.
Los resultados de los exámenes van a ser enviados a tu doctor y su doctor va a mencionarles los resultados con usted.
Okay, the new topic is tinea versicolor. Everyone, please look it up. I keep forgetting this one all the time. I know the Russian equivalent to it, but because I rare encounter it, every time I see like, what is it? What is it? So look it up in your target language, please, everyone, even if it's not your topic to interpret. I hope you, Lisa, while I'm talking, I gave you enough time to look it up.
Yeah.
Okay, so doctor, for the past few months, I've been noticing areas of the body's skin that look without color.
Doctor, últimamente, en los últimos días, did you say days? I'm sorry.
Days.
He notado puntos en mi
Oh,
piel.
months. Sorry.
Oh, that's all right. Doctor, en los últimos meses he notado partes de mi cuerpo que tengan puntos que como que no tienen color.
They began very small, but later they became bigger.
Empiezan muy chicos, pero después aumentan el tamaño.
And is this only one of these spots, or are there anywhere else? Are you the only one with these spots, or is there anyone else in the house with the same thing?
¿Eres la única persona en la casa que tiene estos puntos o hay otras personas en tu casa que tal vez tengan estos puntos en la piel?
Okay, thank you. Good job.
Thank you.
Hilda?
Hello.
Hello. We're continuing with our tinea versicolor. Well, my husband has those spots, but he says that he has them from childhood.
Mi esposo tiene estos puntos, pero él dice que tiene esto desde cuando era cuando era niño.
My son was born normal, and now he's having them also.
Mi hijo nació normal, pero ahora él también los tiene.
This looks like a cutaneous mycosis.
Esto parece como una micosis cutánea.
It happens when moist skin favors the growth of fungus.
Esto ocurre cuando el piel que está húmedo ayuda a crecer los hongos.
Do I have to give him medicine?
¿Lo debo dar un medicamento?
Well, we begin with some cream that he must apply after washing and drying the skin very well.
Bien, vamos a comenzar con una crema que él tiene que aplicar después de bañar y lo tiene que aplicar muy bien.
It's a long treatment, but the skin will return to normal.
Es un tratamiento largo, pero su piel va a regresar normal.
Bring him for the follow-up in 3 weeks.
Lo tiene que traer de otra visita en 3 semanas.
Okay, switching to weight management. Being overweight puts you at greater risk for health problems.
Ser de sobrepeso te pone a mucho riesgo de interpretar need repetition of the last part.
Health problems.
Te pone en mucho riesgo de problemas de salud.
Such as high blood pressure, diabetes, and heart disease.
Como presión arterial, diabetes y enfermedades del corazón.
Make healthy choices each day instead of going on and off diets.
Cada día hay que hacer decisiones correctas de dieta.
A slow loss of 1/2 to 2 pounds per week is best.
Perder peso poco a poco, como de mitad de una libra cada semana, es mejor.
If you lose too much too fast, you often gain the weight back.
Si pierde el peso rápido y muy rápido, siempre lo va a retener de vuelta.
The key is finding healthy lifestyle changes that you can maintain long term.
La clave es buscar una manera buena para mantener su peso.
Do not skip meals. Start the day with a healthy breakfast.
No deja de comer ninguna comida. Siempre empieza con una dieta saludable.
Eat at least 3 meals and 1 or 2 snacks each day to help your body have the energy it needs.
Come 3 comidas y dos meriendas en el día para tener la energía en el cuerpo que el cuerpo necesita.
Control your portion size.
Interpret, I need to check for a word.
And we lost you. Hilda, your sound is off.
I'm here, I'm sorry. Can you repeat the sentence, please?
Yes, control your portion size.
Controla el tamaño de la porción de comida.
Okay, thank you.
Thank you.
Victor, I see your microphone on. Does it mean you're with us? Nope. Okay. Evelyn Oval.
Hi, hello.
Yes, hello. Let's go on with our weight management. Use small plate and take small amounts of a variety of foods.
Use un plato pequeño y escoja cantidades pequeñas de los alimentos.
Do not go back for seconds.
No vuelva a repetir.
Eat when you're hungry. Avoid eating to relax because you're bored or depressed.
Coma cuando, sorry, interpreting this repetition.
Eat when you're hungry. Avoid eating to relax or because you're bored or depressed.
Okay. Coma cuando tenga hambre y evite comer cuando esté relajado, ya sea porque tiene depresión o está aburrido.
Take a walk or do something you enjoy instead.
Vaya a caminar o haga algo que usted disfrute en vez.
Write down all the food you eat.
Escriba toda la comida que consume.
Include the type of food, the amount, and the time you ate.
Incluya el tipo de comida, la cantidad y a la hora que comió.
This helps you become more aware so that you can better manage your eating.
Esto hace que usted esté más alerta y I'm sorry, can you repeat the last part?
This helps you become more aware so that you can better manage your eating.
Esto lo ayuda a que esté más consciente para manejar más sus hábitos alimenticios.
Check with your doctor before starting a new exercise routine.
Chequee con su doctor antes de empezar una rutina de ejercicios.
Be more active by taking the stairs or parking your car farther away.
Sea más activo por escoger las escaleras o estacionar su carro más lejos.
Do at least 150 minutes of moderate physical activity each week.
Haga por lo menos 150 minutos de ejercicio moderado cada semana.
Examples of moderate activity are brisk walking, bike riding, swimming, running, and hiking.
Ejemplos de actividad moderada sería una caminata vigorosa, montar en bicicleta, nadar, correr o did you say run before hike?
Running and hiking.
Oh, okay. Correr y escalar montañas.
It is also recommended to stretch and strengthen your muscles.
Es también recomendable estirarse. Can you repeat the last one?
To stretch and strengthen your muscles 2 to 3 days a week.
Y para fortalecer sus músculos 2 o 3 veces a la semana.
Okay, thank you.
Thank you.
Evelyn Castle is next.
Can you hear me?
Yes, I can hear you.
Okay.
Switching to pyloric stenosis. Okay. Ma'am, what is happening? Why are you coming in such a hurry? No sound, Evelyn. Now there is sound.
Can you hear me?
Yeah, now I can.
Señora, ¿qué está pasando? ¿Por qué estás llegando con tanta prisa?
It's so that my boy is dying. He cannot eat. He vomits everything and hardly cries or moves.
Mi niño está muriendo. Interpreting this repetition, I'm sorry.
He cannot eat. He vomits everything and hardly cries or moves.
Él no puede comer, vomita todo y no se puede mover y no se puede mover mucho.
I have to give him IV fluid immediately. When did he begin to vomit like this?
Tuve que darle.
No sound, Evelyn.
Can you hear me?
Now you can. Mhm.
Tuve que darle fluido. ¿Cuándo fue que?
No sound.
Can you hear me?
Yes, now we can.
I'm not sure what's going on.
It kind of fluctuates. It goes on and off.
Oh, that's weird.
Mhm. Okay. Did you interpret the full sentence?
I did.
Okay, let's go. He was born a month ago and everything was normal.
Él nació un mes atrás y todo estaba normal.
But 3 days ago, suddenly he began to vomit every time that I breastfed him.
Pero de la nada ahora comenzó a vomitar cada vez que yo le doy de amamantar.
Did he have any other symptoms?
¿Él ha tenido algún otro síntoma?
No, he was only crying hard because he was hungry and he was taking the breast.
No, él nada más estaba llorando muy fuerte porque tenía hambre y él estaba bebiendo, tomando de mi pecho.
But afterwards, he was vomiting everything that he had eaten.
Pero después de eso, él comenzó a vomitar todo lo que, lo que él comió.
Now he's not crying normally and he's inactive.
Y ahora no está llorando y normalmente no está activo.
I'm going to request an evaluation by pediatric surgery. Evelyn?
Centro de Piedrata.
Okay, we could not hear that sentence. I assume you did interpret it. No, we didn't. Some babies that have similar symptoms can have a narrowing of the digestive tract.
Algunos bebés que tienen los mismos síntomas pueden tener un interpreter needs to look for a word. You said what kind of tract? I'm sorry.
Digestive tract.
Oh, en el sistema digestivo.
Okay, thank you. Irene?
Yes, I had a problem with the logging in, so I logged in very late. I'm so sorry.
Yes, I was, I saw that. Well, we have 5 minutes left. Would you like to participate?
Sure, I will try.
Okay. So let's finish up the dialogue that we just started with Evelyn. So some babies have similar symptoms. Some babies that have similar symptoms can have a narrowing of the digestive tract.
어떤 아기들은 위장 소화관이 줄어들어서 소화를 못 시키는 증상을 겪기도 합니다.
And that impedes them from eating normally.
Interpreter need to look up the word impede.
Basically doesn't allow them to eat normally.
Okay.
Prevents them from eating normally.
그래서 정상적으로 먹지 못하게 됩니다.
Is that grave, doctor? Do you have to hospitalize him?
이거 큰일인가요? 입원해야만 하는 건가요?
Yes, we're going to hospitalize him.
네, 이 아기는 입원이 필요할 것 같습니다.
I'm going to request a blood test and an ultrasound of the stomach while the surgeon arrives.
외과의가 도착하기 전에 피검사와 그리고 위에 초음파를 진행하도록 하겠습니다.
This seems to be a case of pyloric stenosis.
지금 이 증상은 interpreter need to look up the word. 이 증상은 유문 협착증으로 진단할 수 있습니다.
Okay, switching to nosebleed.
Okay, nosebleed.
Doctor, I'm here because my nose won't stop bleeding.
의사 선생님, 코피가 멈추지 않아서 왔어요.
This has happened other times, and generally it stops in a few minutes.
이 증상이 가끔 일어나는데, interpreter need a repetition for the last part.
Generally,
Stop.
it stops in a few minutes.
몇 분 동안은 멈추기도 합니다.
This time, I've been bleeding nonstop for almost an hour.
이번에는 1시간 동안 코피가 멈추지 않아요.
Do you suffer from some illness or take any treatment?
질병을 앓고 있거나 지금 어떤 치료를 받고 있는 게 있나요?
Recently, I was taking ibuprofen for some terrible headaches.
최근에 두통으로 인해서 이부프로펜을 복용하였습니다.
They have never diagnosed me with any illness.
그리고 어떤 병으로 진단받은 적은 없습니다.
Okay, thank you.
Thank you.
So I see a Victor disappeared. I believe I called everyone's name. Is that right? Did I miss anyone? I don't think so. Okay. So our proof of attendance is going to be allergy. And any questions, anyone?
Hey, can you give us the link again, please?
You mean the attendance link?
Yeah.
Just a second. I believe I already closed that file. Just a second. No, here it is. Okay. Hilda, I see your hand up.
Hi, I have a question, Tatiana. So in a day when someone need to get evaluation, are we still allowed to check, like to look for a word?
Of course. Yes.
Okay,
Yeah.
because I thought maybe you're not allowed.
No. Because even when you work, I mean, you're not a machine. There's no way you can know all the vocabulary and stuff like that. Your skill is about retrieving the necessary terminology as fast as you can, find it in the dictionary. And if also the evaluation is also about how you use your interpreter protocol. So if you need to stop and check the terminology, for example, or if you need a repetition, you just say so. So that's part of the evaluation as well. So it's like the whole process. So of course you can look up the word.
Okay, thank you.
Sure. Okay. Anybody else?